Hello, so you're here for your ear, nose, and throat exam? Okay, great. Could I just confirm your name, please? Okay. All right. Thank you. And your date of birth? Okay. Great. And your contact number? Okay. 530. Okay, thank you. So, you've been referred to me because you've been experiencing some pain in your throat, is that right? Okay, yeah. Can you tell me a little bit more about how that's been feeling and what you've been experiencing? Okay. Yeah. Okay. Yeah. So, when exactly did that start? A couple weeks ago? Okay. And if you could rate the pain on a scale of 1 to 10, where 10 is most painful, what would you say that would be? Okay, alright. And have you had any trouble swallowing? Okay. Any cough at all? Okay. Alright. And do you find that anything helps with the pain in particular? Cold food? Okay, yeah. Okay. And have you had any problems with your nose? Sense of smell or anything? Okay. And what about your ears? Any pain in your ears at all? Okay. And how's your hearing been? Are you having trouble hearing lately? Or is that generally okay? Alright, okay. Just write that down. So it's primarily your throat. Okay. No problem. We'll make sure to take a look at everything just to make sure. Perfect. So, I'm just going to put my gloves on, okay? And to begin with, I'm just going to have kind of an overall look at your face, okay? Looking for any swelling or puffiness, and I would just like you to tell me if anything hurts as I kind of feel around, okay? Alright, good. So you can just sit up straight, good, and just look straight ahead. I'm just going to look around a little bit. Good. Okay. Yep, and just at any point, let me know if anything hurts, okay? Don't see too much swelling in your face overall, which is good. I'm just gonna press on your forehead here. Okay, along the sides. Okay. Good, good, good. Alright. And no pain? It's feeling okay? Alright, good. Okay, just note that down, that everything looks okay from a first glance. Alright, so now I'm just going to move down to your throat and do kind of an external exam, just feeling your glands, okay, and around your neck. Good, so just please let me know if anything feels tender or especially painful as I kind of feel around your neck here, okay? feel those glands. Okay. A little bit swollen here. And if I press just below your ears, how's that feeling? Okay, yeah. A little bit tender there. It's gonna feel around the front, down your throat, okay? Alright, I'm just going kind of around the sides here, just feeling down. Okay, going to press on your throat. Okay, could you try and swallow for me? Okay, good. Alright, how's that feeling? A little bit painful, okay. Good, just feel under your chin here. Okay. And along the sides of your jaw, just looking for any swelling around there. Okay. Yeah, so I can definitely feel that your glands are a little bit swollen. Okay. Now I'm just going to look inside your throat. Okay. I'm gonna grab my light, and if you could just open up, I'll start by just having an initial look around, okay? And then I'll get my tongue depressor and we'll have a deeper look. Okay. So please just open up. Thank you. Okay, definitely red back there. Could you just say ah? Alright, good. Thank you. Okay. Just looking at your gums and your tongue as well, just to see if there's any signs of infection or anything abnormal. Good, good, good. Okay, you're doing very well. Okay. And have you noticed your throat being red at all? Have you had a look yourself, maybe in the mirror? You have? Okay. When did you notice that? Okay, the other week? Yeah. Yeah, it's definitely looking quite inflamed. You've got some bumps. Alright, and just feeling your lips here. Okay, not too dry. Good. You're drinking enough water. Okay, good. Yeah, it's important to stay hydrated. Okay, I'm just going to grab my tongue depressor here to get a deeper look. So if you could just open up, I'll stick this on top of your tongue. Okay. Alright. Yeah, I just want to make sure this isn't strep throat or anything too serious. But it looks like it's just a mild sore throat, which is good. Okay, great. So, does your throat feel dry at all? Okay. And are you having trouble speaking? Okay. Okay, so it's not too bad then. Right, we're just going to move onto your nose now to make sure that your nose is okay. I didn't see too much mucus build up in the back of your throat, so that indicates that your nose is pretty clear. Yeah, are you feeling kind of stuffed up at all? No, okay. If you could just take your finger and cover one of your nostrils and then just breathe out the other. Yep, just like that. Okay, good. And switch sides. Okay, so that's fine. Good, not too stuffy. So I'm just going to feel around your sinuses now. Okay, good. Just to feel if there's any pressure. Just let me know if that feels uncomfortable at all. That's okay? Alright. Just gonna go in between your eyes here. Between your eyebrows, down your nose. Okay, just kind of feeling around your nose. Good, and then just a little bit on your forehead. Okay, under the eyes. Okay, yeah, I'm not feeling too much pressure, which is great. Okay, so your nose seems fine. I just want to test your sense of smell really quickly, okay, just to make sure there's no problems with that. So, I just have this spray bottle here with a scent. I'm going to spray it on this cotton swab and just ask you to identify the smell, okay? Alright. Here we go. Okay, just take a deep breath in. Okay, what's that one? Orange, good. Alright, next one. Can you identify that one? Strawberry, great. Okay, we'll do one more. What's that one? Pine, great. Okay, so your sense of smell is fine. No problems there. Great. So we're just going to move on to your ears now for the last part, okay? Because yeah, your throat and your ears, they're all linked. So we just want to make sure that nothing's going wrong inside your ears. Okay, so I'm just going to start with an external exam. Just kind of looking at the outside of your ears, just to make sure that everything looks normal, okay? So if you could just tilt your head this way slightly, I'll just take a look at your left ear. Okay, great. So, let me see. Okay. Just going to grab my light. Just take a look at the outside. Okay. Good. I'm just going to take a look at the other ear. If you could just turn this way. Great. Okay. Right. Okay, good. Yeah, I'm not seeing anything wrong with the outside of your ear. That's looking fine. I'm just going to feel both now. Okay. And does that hurt when I kind of tug on the top? Okay. What about this one? Okay. I'm just gonna feel just under a little bit, kind of under your earlobes. Okay. Okay, great. I just want to take a look in the inside now. So I'll just use my otoscope here and take a deeper look. So you could just turn this way a little bit. Great. I'll just look inside. So okay. I'm seeing a little bit of wax build up in this ear. Yeah, it's not too abnormal, but it is something that maybe we can clean out a little bit. Okay, good, but for the most part, it's looking healthy and normal, which is great. Okay, good. Just check the other side. Okay. Same thing again on this side, just a little bit of wax buildup. But yeah, it's nothing that we can't take care of. Just kind of pulling to go a little bit deeper inside here. Okay. Alright, great. So yeah, you do have some slight wax buildup. So I'm just going to take some of this solution here and drop a little bit of that into your ears, and then take a cotton swab and just kind of clean that out a little bit. Yeah, I won't go too deep inside. Alright, so let me just apply some of this to this ear. Okay. Alright, good. And same thing on the other side. Okay, good. Now I'll just take my cotton swab and clean that out a little bit. Okay, great. Alright, is that feeling okay? Alright, good. I'm just gonna do the other side now. Okay. Okay, great. Good. Yeah, that should be feeling a little bit more fresh. Great. So, lastly, I just want to test your hearing. Okay. Alright, so I'm going to hold my hands out on either side, and if you could just close your eyes, okay? I'm going to wiggle my fingers, and I would like you to tell me either right or left. Okay, great. So, close your eyes. Good. Good. Okay, good. I'm going going to move my hands a little bit farther away now. Okay, good. Okay, great. Now I'm going to bring my hands close to your ears and move them slowly out while making a sound, okay? And I want you to tell me when you can't hear it anymore. Alright, good. Okay, perfect. We're gonna do that one more time. Okay. Okay, great. Good job. We are almost done. I'm just going to whisper some numbers into your ears, and I would like to have you repeat them back to me. Okay. Good. Okay. 4,672. Good. Okay. 9,867. Okay, one more time. 877. Good. 2,405. Excellent. Okay, great. So your ears and nose are seeming okay. It's just your throat that you're kind of struggling with. Yeah, we expected that. So I think what I'll do is just prescribe you some medication to see if the pain can go down a little bit. But I would really recommend you use home remedies, okay? So lots of tea with lemon and honey. Yeah, and make sure you're drinking enough water, of course. And you can drink juice if you'd like. But you said that cold things help your throat. Okay, yeah, I would recommend getting lots of popsicles. You can make smoothies. Yeah, things like that. And do make sure, of course, that you're getting plenty of rest and not using your voice too much if it's hurting to talk. Yeah, just make sure you rest it as much as possible. Okay, good. But I will prescribe you some medication for the pain. So let me just write that up. Okay, so I will give you that. Here you go. Okay, great. And with that, I think you are all set. But please do give me a call if the pain continues for more than a week or so. And we can always do another check. Alright, great. Well, I hope that you feel better. Okay, thanks for stopping by. And yeah, I'll see you hopefully not too soon.